And I'm going to speak out those questions and I'm going to give you the options. Listen clearly. If you have a notepad or something with you, you can just write down the options and just practice. That's the best way to practice pharmacology, recall and revise. And let's see, right? So even if you get it right, very good. If you do not get it right, not to worry. The whole actually emphasis or the main, why I wanted to have these sessions is so that you know where is the lack area and you can go back and revise, so that will be your best. The portions will be covered really well for you then. All right. So good evening. Start with the first question. Right. The first question I'm going to start. Right. Okay. So please listen to it now. Agranulocytosis is a major adverse effect of. Agranulocytosis is a major adverse effect of. First option is propylthiouracil. Second option is iodine. Third option is radioactive iodine. Fourth option is none of the above. I will repeat the question. Agranulocytosis is a major adverse effect of propylthiouracil, iodine, radioactive iodine, or none of the above. So type in your answers. Which of these causes agranulocytosis? Yes, come on. Which of these drugs causes agranulocytosis? Propylthiouracil, iodine, radioactive iodine, or none of the above? Okay, Dosa 0059 says radioactive iodine. Arnav says none. All right, more options. Let's have more options. With carbimazole. Okay, you say with carbimazole. Okay. Yes, any more options? Okay, Rajiv Ranjan says radioactive iodine. All right. Muthu says propylthiouracil. Okay. Yes. So the correct answer is propylthiouracil. Right, Muthu. It is propylthiouracil. So this agranulocytosis is a very rare side effect. It's not a common side effect with propylthiouracil. So it's a rare side effect. Less than, as the books write, it's less than even 1%. So, and it will occur only in the first few weeks or months of giving the treatment with propylthiouracil. So just remember that agranulocytosis among these is seen with propylthiouracil, but it is not the common side effect. It's a very rare side effect. Okay. All right. Let's go to the second question. Is an estrogen that is used in most combined hormonal contraceptive pill is? An estrogen that is used in most combined hormonal contraceptive pill is. First one, clomiphene. Second option, estrone. Third option, ethinyl estradiol. Fourth option, diethylstilbestrol. Again, I will repeat. An estrogen that is used in most combined hormonal contraceptive pill is. Number 1, clomiphene. Number 2, estrone. Number 3, ethinyl estradiol. Number 4, diethylstilbestrol. So which of them is used most commonly in the hormonal contraceptive pills? Arnav says ethinyl estradiol. All right. Okay. Dosa also says ethinyl estradiol. Yes, more options, more participation. Let's have it. Whatever you know, whatever you can think of, just write the options. If you know very well, even if you don't know, that's okay. Even if you're wrong, even if you're right, doesn't matter. Just write whatever you think can be the answer. So you know that there is some. Rajiv says ethinyl estradiol. Okay. All right. Or anybody else who has a different opinion than this? Ethinyl estradiol ke alawa, somebody feels ki there is another better option. All right, so the correct option is yes, definitely ethinyl estradiol. That is the right answer. The most common estrogen used in the hormonal combined pill is ethinyl estradiol. Now, tell me which progesterone is used. Which progesterones are used in the combined pills? Can anybody name the progesterones that are used along with this estrogen? Yes, Mathu, ethinyl estradiol is the correct option. So, progesterone kaun sa use? Which progesterone do we use alongside? Because we're talking about the combined pills. So, which progesterone do we use? Levonorgestrone. Okay, levonorgestrel is one. Yes, we use this. Any other? Levonorgestrel, yes. Yes, that's a very correct answer. Levonorgestrel is a progesterone, and because they have an anti-ovulatory action. So, yes, norethindrone. Arnav says norethindrone. So the most common ones which are used actually are your levonorgestrel, your norgestrel, and desogestrels. These are the ones which are most commonly used, right? And in the estrogen, we are using ethinyl estradiol. The doses of ethinyl estradiol, these are usually in micrograms, or progesterone ka dose, it is usually in your milligrams. So these are the important points to consider, right? Okay. Any idea why you combine progesterone with estrogen? Why do we combine the progesterone with estrogen? Does it, good evening. Why do you combine progesterone with estrogen? क्यों combine करते हैं progesterone estrogen के साथ? What will happen if you only give estrogen? क्या problem हो सकते हैं? What can happen to the patient? To regulate the effect. What kind of effect do you want to regulate? What kind of effect you want to regulate? Why we don't give estrogen alone throughout, the time, and why do you need to add progesterone to it? Reduces the risk of very good. Yes, it reduces the risk of endometrial cancer. Estrogens are known to cause, they are going, if you used alone, and yes, carcinogenic. Definitely if you're using it alone, you'll need a higher dose, and they can, because they cause endometrial proliferation, so they can have a risk of endometrial cancer in the patients. So to combat that, we have to add progesterone, because it will not only decrease the dose of estrogen, and therefore it decrease that area. That is definitely decreased. Or the other thing is that progesterone also ensures prompt bleeding, at the end of the cycle. So that's another effect of progesterone. So very good. Ethinyl estradiol is the correct answer for this. Now the third question is, all of these testosterone derivatives can be given by oral route, except all of these testosterone derivatives can be given by oral route except first option, testosterone enanthate. Testosterone enanthate. Second option, last point is like progesterone the previous question, right? So progesterone, when you give it along with estrogen, what it does is it will decrease the dose of estrogen that you have to otherwise give. And because estrogen causes endometrial proliferation, it leads to cancer. It can progress to cancer in that patient if it is given for some increased amount of duration. So what we do is we add progesterone, and progesterone also has an anti-ovulatory effect that is additional to this. So when you give progesterone, you'll have to decrease the dose of estrogen. So you decrease the dose of estrogen, and therefore the chances of the patient landing in that cancer or whatever endometrial proliferation goes down. And also progesterone, it ensures prompt bleeding also towards the end of the cycle. So that's the second effect. But most important is why progesterone is usually combined to take care of that endometrial proliferation which is caused when you give estrogen alone. Otherwise, you'll have to give it alone for a long period of time, and that leads to endometrial proliferation, and uske baad it can lead to cancer if used for a long period of time. That's the reason. Okay, let me get back to this question. All of these testosterone derivatives can be given by oral route, except the first option is testosterone enanthate. Second option is oxymetholone. Third option is danazol. Fourth objection is stanozolol. I will repeat. All of these testosterone derivatives can be given by oral route, except testosterone enanthate, I didn't say allopurinol, testosterone enanthate, oxymetholone, danazol and stanozolol. इनमें से which cannot be given by oral route? Arnav says testosterone enanthate. Okay. Yes, any other options? Any other somebody else who has a different opinion than Arnav? He says it's testosterone enanthate. All these testosterone derivatives can be given by oral route except testosterone enanthate. Rajiv says testosterone enanthate, oxymetholone, danazol and stanozolol, which cannot be given by oral route. Rather, the question is, इनमें से कौन सा we cannot give by oral route? Testosterone enanthate, yes. Try. Everybody should try. Okay. So the correct option is yes, Arnav, yes, Rajiv, you're correct. It is testosterone enanthate. So this testosterone enanthate is mostly given by intramuscular route only. Only intramuscular route is there. Now, let's see oxymetholone, stanozolol. What are these? Do you have an idea? What are these? Oxymetholone, stanozolol. Where are they classified? Oxymethazone, stanozolol. What are these? No idea? What is oxymetholone and stanozolol? What is danazol? Anabolic steroids. Excellent. They are anabolic steroids. What about danazol? Testosterone enanthate. Yes, Muthu, it's testosterone enanthate, the correct option. What is danazol? What is danazol? Yes, enanthate is right. What is danazol? क्या होता है? What is danazol? So oxymetholone, stanozolol are anabolic steroids. What about danazol? Sunay, have you heard about it? No, danazol is not an aromatic inhibitor. वो होते हैं anastrozole, letrozoles. Gonadotropin inhibitor. Okay. Gonadotropin inhibitor. right? But how do you classify this drug? Yes, it inhibits the gonadotropins. Basically, it suppresses the actually secretion of gonadotropins from the pituitary, right? So it can be used in as well as in men as well as in women, right? So isko also we call it as impeded androgen. Sometimes there is an MCQ I've seen, which of them is an impeded androgen, right? So this is danazol. Impeded androgen is another name for danazol. Okay, so the stanozolol, these are the anabolic steroids, and danazol is an impeded androgen. So remember that. And it is used in endometriosis, menorrhagia, even in fibrocystic breast disease. So these are the various uses of danazol, right? So they all can be given by oral route except testosterone enanthate, which is only given by intramuscular route. So point to remember about that. All right, let's get to the next question. Back pain and myalgia. Back pain and myalgia are the characteristic adverse effects of which of the phosphodiesterase 5 inhibitors? I will repeat. Back pain and myalgia are the characteristic adverse effects of which of the following PD phosphodiesterase 5 inhibitors? The options are: first is sildenafil, second option is tadalafil, third option is vardenafil, fourth option is avanafil. Okay, I will repeat the options again: sildenafil, tadalafil, vardenafil, and avanafil. Back pain and myalgia is the characteristic side effect of which of these? Which of these phosphodiesterase 5? They are all phosphodiesterase 5 inhibitors. But which of these is associated with back pain and myalgia? Which is the tadalafil? Arnav says tadalafil. Okay. Any other? Back pain and myalgia are seen with which of the following phosphodiesterase 5 inhibitors? Sildenafil, tadalafil, vardenafil, or avanafil? Yes, come on. Let's have the answers. Yes. You know what phosphodiesterase 5 inhibitors you all have heard about? Tadalafil. Okay, Rajiv. Very good. Tadalafil. All right. Any other? So this is the correct answer. It is tadalafil. It causes back pain and myalgia. Yes. Do you know the reason why it causes back pain and myalgia? The reason behind it. क्यों cause करता है? Why does it cause back pain and myalgia? Tadalafil is a very important drug actually currently, so I just wanted to focus. Why it causes back pain and myalgia? Any reason? Any idea? Because it also inhibits phosphodiesterase 2. Apart from inhibiting phosphodiesterase 5, it also inhibits phosphodiesterase 2. And you know that tadalafil is one of these drugs which is used even in pulmonary artery hypertension. It has a very important role for the treatment of pulmonary artery hypertension. Okay? Because it will cause increase in the the nitric oxide. It causes relaxation of the pulmonary artery vessels. So resistance come करती है from the pulmonary artery vessels. So it is used in pulmonary artery hypertension. So this is very important for that. And the other drug here, which is vardenafil, what is the most important side effect associated with vardenafil? इसमें तो हो गया back pain, myalgia because of tadalafil. What about vardenafil? Which is the most troublesome side effect which is seen with vardenafil? Yeah, side effect क्यों है? It is because of phosphodiesterase 2. So vardenafil का main इसका भी side effect एक important है, which is asked, it is QT prolongation that is associated with vardenafil. So you have to be very careful, in cardiac patients. So this is important for vardenafil. QT prolongation, vardenafil, back pain, myalgia, tadalafil. And tadalafil का जो दूसरा चीज you should know is that it is one of the drugs used for pulmonary artery hypertension. Okay, so I had just posted in the group, there's a drug which is available, which is called as endoblock T. So endoblock T is a combination of T is for tadalafil, and the other one, I'll be coming to that drug in another MCQ. So they are used together and they are very effective for pulmonary artery hypertension. So when I come to it, I'll tell you about that drug. In the subsequent MCQs, it will be there. So remember that about tadalafil, right? All right. Let's go to the next one. Now listen to this carefully. Prostaglandin E analogs. Prostaglandin E analogs are useful in all except. Prostaglandin E analogs are useful in all except impotence, peptic ulcer, medical termination of pregnancy, and glaucoma. Prostaglandin E analogs are useful in all except impotence, peptic ulcer, medical termination of pregnancy, and glaucoma. So prostaglandin E analogs are useful in all except बताना है, where are the prostaglandin E analogs not used, or which is that condition where prostaglandin E analog is not used. The options are impotence, peptic ulcer, medical termination of pregnancy, and glaucoma. Glaucoma, excellent. In glaucoma, prostaglandin F2 alpha analogs are used, right? So Arnav has given the correct answer, which is glaucoma. So I'll just elaborate on this कि जो glaucoma है, okay Arnav, prostaglandin F2 alpha analogs, which ones? Can you name those analogs? कौन से use होते हैं in glaucoma? The prostaglandin F2 alpha analogs. Which ones are those? Yes, Rajiv, excellent. Glaucoma is the correct option. Which is used? Which one in glaucoma? Can you name the drug which is used in glaucoma? Very good, latanoprost. Alright, latanoprost is a prostaglandin F2 alpha. So it is not a E analog. So if I talk about, let's say, peptic ulcer. So let's go on. First, let's go to impotence. Which analog, prostaglandin E analog, is used in impotence? कौन सा use करते हैं? What is the name of that analog, prostaglandin E analog? Any idea? Prostaglandin E analog, which one is used? L-prostadil, very good. L-prostadil is used here. Peptic ulcer, which one is used for peptic ulcer? Peptic ulcer में कौन से use करते हैं? Prostaglandin analog used in peptic ulcer. Quick. कौन सा use करते हैं? Prostaglandin analog used in peptic ulcer. Very good. Misoprostol. Prostaglandin analog used in medical termination of pregnancy. MTP पे. Prostaglandin analog used in MTP, medical termination of pregnancy. Which one? Which one? MTP में कौन सा यूज करते हैं? Prostaglandin analog. You can use it as a pessary, right? They can use it orally or you can use it as a pessary इसमें. That's a hint I'm giving. कौन सा यूज करते हैं? Prostaglandin analog in MTP, medical termination of pregnancy. कौन सा यूज करते हैं? Which one is used for MTP? Prostaglandin E analog. Well, then this is for you to find out. Which one is used for MTP? The prostaglandin analog used for MTP. Let's proceed to the next one now. Bisphosphonate induced osteomalacia. Right? Bisphosphonate induced osteomalacia is commonly seen with. Bisphosphonate induced osteomalacia is commonly seen with. First is etidronate. Second, zolidronate. Third, pamidronate. Fourth, alendronate. Bisphosphonate induced osteomalacia. So these are bisphosphonates, but which of them causes osteomalacia? Etidronate, zolidronate, pamidronate, alendronate. कौन सा cause करता है? Yeah, mifepristone is, but mifepristone is not a prostaglandin analog. So we use misoprostol and we can use gemiprost and all these are pessaries along with mifepristone. Okay, so coming to this, bisphosphonate induced osteomalacia is commonly seen with. कौन सा bisphosphonate causes osteomalacia as a side effect? Etidronate, zolidronate, pamidronate, alendronate. Which one of them causes osteomalacia as a side effect? Which one of them? Atidronate. Okay, Rajiv says atidronate. Okay. Any other? Etidronate, yes, yes. Or pamidronate. Arnav says pamidronate. Okay. Any other options? Arnav is not sure. All right. No problem. No problem. That's fine. Okay. Kailash Tewasi says etidronate. Okay. Any other? Any other thoughts? Any other guesses? Or if you know that very well. Yes, so the correct, let me tell you the correct response. The correct response is etidronate. Etidronate is most commonly associated with osteomalacia among all these bisphosphonates. So you have to remember this. That's why it's not currently very often prescribed because of this problem. Not much used. So remember this with etidronate. Etidronate more prone to cause osteomalacia. So currently not much preferred. Right? All right. Next one, let's go to which of the following is an oxytocin antagonist? Which of the following is an oxytocin antagonist? Option. First one is ritodrine or ritodrine, however you pronounce. Second is etosebin. Third is embricentin. Fourth is cyproterone acetate. Which of the following is an oxytocin antagonist? Ritodrine, etosebin, embricentin, or cyproterone acetate? Etosebin. Arnav says etosebin. Okay. Very good. Etosebin. Any other? So, okay, let me go through the options and then we'll see. What is ritodrine or ritodrine? Which drug? Ambrisentin. Okay, Rajiv says ambrisentin. Class says etoseban. All right. So let's go to one by one. Ritodrine, the first option. What is that? कौन से class को belong करता है? Ritodrine. You should know about all the options and then you'll be clear. Ritodrine belongs to which group of drugs? No? Ritodrine belongs to which group of drugs? It is a beta. Very good. It's a beta 2 agonist. So ritodrine is a beta 2 agonist. So not the correct answer. Second is etoseban. 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 So etoseban is an oxytocin antagonist. So that is the correct option. Let's go to the third option. Third option was ambrisentin. Ambrisentan. Ambrisentin. Ambrisentin is actually an endothelin antagonist. क्या है ये ambrisentin? It is an endothelin antagonist. So I was talking about the drugs used for pulmonary artery hypertension, and the name of the drug which is available in the market is endoblock T. तो जो endoblock T का मतलब क्या है? We are using an endothelin blocker or endothelin receptor antagonist. इसलिए उसका नाम है endoblock T. So endo means endothelin blocker or antagonist, which is your ambrisentin, and T जो है that is for tadalafil. So the drug का नाम बन गया endoblock T, and this drug is very effective or currently one of the drugs which is used for pulmonary artery hypertension. Endoblock अकेले भी available है. Endoblock T is in combination with tadalafil depending upon the severity of the pulmonary artery hypertension. So this is how the name has come up. ठीक है? Ambrisentin plus tadalafil. Ambrisentin is an endothelin antagonist and therefore it is endoblock. इसलिए उसका नाम endoblock पड़ गया. Very effective therapy. Okay, the last option here was cyproterone acetate. So cyproterone acetate is an androgenic receptor antagonist. So the correct option in this was etoseban. Etoseban is an oxytocin antagonist. So the rest of the drugs I have told you where they belong to. So just know this. Ambrisentin is one of the endothelin antagonists, kind of newer for some. So you can just write down जहाँ पे आप list of drugs, where you're making the list of drugs which you need to know, and this is something new. So please write down in that. So ambrisentin, endothelin receptor antagonist, can be asked as an MCQ also. Right, let's go to the 8th MCQ for today. It's an easy one, very easy. This class of drugs is used to prevent contractions of the uterus. This class of drugs is used to prevent contractions of the uterus. First option is oxytocics. Second option is tocolytics. Third is antiprogesterones. Fourth is estradiol. Okay? Which of these drugs prevents contraction of the uterus? Oxytocics, tocolytics, antiprogesterones or estradiol? It's actually a very simple one. कौन सा group prevents uterine? Tocolytics. Yes, absolutely. Tocolytics are the groups of drugs which are basically the other name for uterine relaxants. ठीक है? Contractions cause करते हैं. The other group, the oxytocics, and tocolytics mean uterine relaxants. So they decrease the uterine motility. So अभी जो हमने किए थे ritodrine, the first इसमें beta 2 agonist, they can also do that, right? So oxytocin antagonist, they also work as uterine relaxants. Then progesterones work as, very good Rajiv, yes, tocolytics, Anhad, yes, tocolytics. सो टोकोलिटिक्स में ये सारे ड्रग ग्रुप्स आते हैं, एड्रीनर्जिक एगोनिस्ट, कैल्शियम चैनल ब्लॉकर्स, ऑक्सीटोनिन एंटागनिस्ट, मैग्नीशियम सल्फेट, प्रोजेस्ट्रॉन, नॉट एंटी प्रोजेस्ट्रॉन बट प्रोजेस्ट्रॉन्स, बट दे आर नॉट वेरी इफेक्टिव एज सच. तो ये वाली जो ड्रग ग्रुप्स हैं दे आर क्लासिफाइड अंडर टोकोलिटिक्स, राइट? Excellent. Now let's go to the 9th question of the day is, which drug increases the liver and tissue sensitivity? Which drug increases the liver and tissue sensitivity to insulin? Which drug increases, let me just get this, increases the liver and tissue sensitivity to insulin by activating AMP activated protein kinases, which play a key role in the insulin signaling. So basically, which drug increases the liver and tissue sensitivity to insulin by increasing the AMP activated protein kinases, which play an important or a key role in the insulin signaling? The options are: first, insulin; second, metformin; third, acarbose; fourth, glimepiride. Which of these basically increases the liver and tissue sensitivity by acting on the AMP activated protein kinases? So इसमें insulin sensitizers के बारे में ही पूछा गया है. So which of the out of these, insulin, metformin, acarbose, glimepiride, which of them is an insulin sensitizer? That's the simple way to understand. Because it's very, if you know the mechanism, you know which one of them is an insulin sensitizer, which one of them is an insulin secretagogue, right? So you can, metformin, excellent. Metformin, bigonides group of drugs, they are insulin sensitizers, ठीक है? Acarbose is a alpha glucosidase inhibitor. Glimepiride belongs to sulfonylurea. So those are insulin secretagogues. They help in secretion of insulin. So इसमें clear cut answer is your metformin. These are your insulin sensitizers. That's the most common. These are one of the drugs of choice currently for type 2 diabetes mellitus until and unless contraindicated. So they are the very, very good drugs for type 2 of diabetes mellitus. Right? So last question of the day is, in Addison's disease, the drug of choice is, in Addison's disease, the drug of choice is number 1, hydrocortisone; number 2, betamethasone; number 3, aldosterone; number 4, DOCA, DOCA. Out of these, which is the drug of choice for Addison's disease? Number 1, hydrocortisone; number 2, betamethasone; number 3, aldosterone; number 4 is DOCA. So out of them, which is used for Addison's disease? Drug of choice for Addison's disease. Yes, which is the drug of choice for Addison's disease? Which of the steroid here is the drug of choice for Addison's disease? Arnav says betamethasone. Rajiv says aldosterone. Okay, any other? Anhad says betamethasone. Okay. Other options? Any other option? So I'm asking about the drug of choice here. ठीक है? So the underlying thing is drug of choice. कौन सी है? और कोई और? Anybody has a different opinion than these options? No? Okay. Right. The answer is hydrocortisone. ठीक है? Hydrocortisone is the oral drug of choice for chronic adrenal insufficiency, which is your Addison's disease, because it has glucocorticoid action as well as a mineralocorticoid action. So for replacement, this will be very good and rapid. Replacement ke liye we need both of them here. Now, beta-methazone as such is a glucocorticoid, but it doesn't have any mineralocorticoid effect. Aldosterone, remember, we don't use it clinically because it has a very low bioavailability. So clinically, हम use नहीं करते aldosterone. It's inside. It is one of the most potent mineralocorticoid in the body, but it cannot be used because of its low oral bioavailability. And जो डोका है last में, it has no glucocorticoid action. Occasionally used, but please remember the drug of choice for Addison's disease is, if अगर पूछा जाता है, that is your oral drug of choice is hydrocortisone, right? So these were the 10 questions I could generate for today's session, and the next one I'm going to deal with 10 more questions from endocrinology, so we can have more questions to solve. And what the main aim here is actually, it is always the revision. You may be doing anything, and when you come back to such revisions, you can always recall what you've studied before. And in case there are so many questions you already know, when it is actually when you do these questions and you feel happy when you know most of the questions, and even if there are one or two which you do not know, the best thing is you go back, you write down. Please do write down, because ऐसे भूल जाएगा and next time दोबारा आएगा, you won't be able to recall. So whatever you have not been able to answer, you feel there is little difficulty to remember and you didn't know about them, so try and write down those things, because that is how you get the best out of these sessions. You just look and you see, and then you forget. Until unless you write down, you will not be able to recall and remember for later purpose. जैसे मैंने 2-3 drugs important है जिनको if you might not be knowing about them, so or you forget about them. Okay? So there are certain new things which have come up. There are kuch drug of choice which is there. You just remember that is the drug of choice for that. So note down on a separate sheet on your pharma notes, jahan pe bhi hai, on your registers, and this is how you will increase your knowledge with every session, with every revision, right? Because it's a very, and again say, pharmacology is very volatile. So until and unless you repeatedly revise and then go back to what you have forgotten, that's the only way to master this subject. Okay? So till date, even teachers, I will tell you the fact ki even if you have been teaching pharmacology for like 10 years and 4 years, you still will forget. There is no God here कि उसको 100% written रहता, ऐसा कुछ नहीं है. It is why? Because they keep going through this subject again and again and again. So many things have been registered now, but there are still so many things that we are humans. You will forget certain things. That is okay, right? But how you actually, because you as a student, you have to pay for an exam, and it is mandatory कि you need to remember certain things, and for that the best way is the revisions. Do as many revisions as you can, attend as many sessions as you can, irrespective of whether you are doing that topic right now or not, because that actually will really help you. And because the things which have already in your mind over there, या आपके दिमाग में पहले से हैं, आपने पढ़ी हैं, they will start coming out and make more sense to, yeah, I remember this, I know this. So that's the basic aim of this session, right? I hope you got enough value for this, and looking forward now to see you in the next session where I'll come up with more questions. And yeah, so there's another thing. If many of you are from the Simply Pharmacology WhatsApp group, and in case somebody is interested in joining, it's a free group, Simply Pharmacology WhatsApp group, where the questions are being posted, some of the students are discussing. In case anyone is interested, we'll post the link when this video gets posted, we'll post in the comment section the link to that, so you can join. And it's just for discussions of questions and anything important, updates, and so looking forward to see you there also. Yeah, so if there is any other suggestion for any live sessions, please let me know, message me, and I will definitely cater to that, right? So I guess, okay then, I'll take your leave. Have a great weekend. See you next time, and take care. God bless.